The San Francisco General Hospital community came together to hold a vigil for a coworker killed on the job. 51-year-old Alberto Rangel died Saturday after a patient allegedly stabbed him multiple times in the neck and shoulders on Thursday. Video from Citizen App shows the moment he was rushed to an ambulance. Amanda Harry spoke to his friend about the tragedy and the legacy he leaves behind.
A somber night outside San Francisco General Hospital, illuminated by candlelight, as staff remembered one of their own.
But Alberto was there to help, and he was failed.
Maddie Abul worked with the victim, 51-year-old Alberto Rangel. But beyond the walls of the long-term HIV clinic, they were also friends.
He was just such a passionate, wonderful person, and had so much more life to live.
She says he loved fashion, art, and had a great sense of humor. He also loved his job, going above and beyond, even running a support group for those living with HIV and AIDS.
There are people who are alive today because of him. For him to lose his life at work, when he was there to provide services to patients, it's not right. It's not right. It's just a service. It's a betrayal.
Abul was just feet away when Rangel was allegedly stabbed. She heard screaming from outside her office.
And I opened my door, and Alberto is on the floor.
The San Francisco Sheriff's Office says 34-year-old Wilfredo Tortolero Arechi has been arrested for the stabbing. He was still there when Abul walked out. She recognized him as a patient.
I saw Wilfredo. I looked him in the eye, and he saw me too. He probably recognized me. I recognized him. And he just stood there and looked at everything and looked what he had done, and then put his shirt over his head, perhaps to hide his identity, and then voluntarily put his hand behind his back.
She says during this time, her co-workers were trying to help keep Rangel alive, telling him they loved him and to stay with them. But on Saturday, he passed away from his injuries. UPTE union representative Shay Dean says they're going to make sure the hospital reevaluates their safety measures.
What I know is that social workers have been raising the alarm about safety issues for years, to have been met with pretty much radio silence. And you know what I know is that our colleague and our friend and our loved one deserves more than our grief. They deserve change. And I know that we will not stop until we get that.
The Department of Public Health said in a statement that they'll be adding more security, limiting access, and installing a weapons detection system. But Abul still worries it won't be enough, saying they raised concerns about the suspect beforehand, including filing reports, and nothing happened.
We are furious as a community. This is unforgivable. A lot of us don't want to come back. A lot of us can't come back.